Well, nice to see you. Thank you for taking your time out of your busy schedule.
Always.
Yes, I just came back from Columbus Isle, El Salvador in the Bahamas, and after my LaZrPlastique, I was able to see the beautiful ocean, the beautiful surroundings, and I just feel wonderful after my procedure.
It's been my pleasure. That was my promise. You'd given me a deadline, right? You have to go to this exotic vacation you had planned, and thank God everything went beautifully. Sure. And always, just great to see you all back.
Yeah.
I call you all my Mona Lisas, right? It's a pleasure. And to sit down no matter how busy it is. So shoot your questions. You had some questions.
Oh yeah, I have some
your
questions.
radial keratotomy
Yeah,
friends had.
and my radial keratotomy friends, and I do have some questions.
Please go ahead.
So my first one is that after my procedure, I'm like, why can't I wear my glasses or get some glasses or contact lenses?
Certainly.
Why is that?
Okay. So again, for all patients who really keratotomy who are watching, my wonderful patients who are coming back post-op and seeing great, these are all impromptu. There's no Starbucks card for any of us. It's no script at all, and I'll be answering her questions impromptu right there. So she's asking, why can't I wear contact lenses after her surgery that she had LaZrPlastique for her complex cataracts through her very abnormal radial keratotomy corneas, which has scars and high irregular astigmatism. First of all, how did your surgery feel? Any pain, anything?
Oh, no, definitely no. And I was scared.
I know. And doctors, she had surgery again. This is not reason for you to come here, but I love to escalate on talents of doctors itself. She had surgery without anesthesia, with numbing drops, and in our surgical suite right next door.
Oh, beautiful. Definitely.
And we did both her eyes, and then she went for her exotic vacation. And here she has come back and more questions for me, so that's fine.
Yeah.
So her question is, why can't she wear contact lenses after her surgery that I did? Well, contact lenses, first of all, may not be even needed by the time she heals. Remember again, guys, I don't promise any radial keratotomy patient that they will see without glasses. But I love to strive to give you all visual freedom, no matter how difficult the situation is. And contact lenses, if she wears at this stage, it will distort her cornea and change the shape. So I will not know whether she is taking time to heal or she changed the shape, and therefore no contact lenses. Next question.
Okay. I had 8 cuts, but then you say that mine is more difficult than someone that had 18. How's that?
Yes. So I've talked about this in many videos, teaching videos before. I've even done patients through 40 cut radial keratotomy cataracts. Yes, 38, 32, many of these. And what is important, as I've said, is not just the cuts, how the cuts were made. If they're perfect straight, like I just did one last week, 28 cut, was more easier than the 4 cut I did last week in a patient whose eyeball was so deep inside her orbit. She had very flat cornea, scars in the center, pseudo exfoliation of the lens capsule, and immeasurability of the cornea because it was bulging despite the 4 cuts. So that's much more complex now compared to the other one I did with 28 cuts. In your case, even though you had 8 cuts, the 8 cuts had caused very high irregular astigmatism with bulging of her cornea. We call that ectasia, right? And that causes such high level of improbability or inaccuracy in measurement, you don't even know what lens power to use. And on top of that, the cornea is still moving like an earthquake and changing vision. That's what makes your case more complex. Then the 8 cuts, some of your cuts, if you remember, were in your pupillary area. While cutting, it had gone extended into the central sacred area of your cornea. That makes it difficult. But what really makes it difficult, and I'm talking more to surgeons when I teach this way, is the fact that I want everything for her. So her being complex doesn't decrease my desire. That's what makes my work very difficult, because I still want everything for you.
Wow, and I know that. I know that you've been so personal. You know, even on the day of my surgery, you called. Every time you called, and people from your office followed up, and it was very personal. It's like you say, we become family.
It's my privilege. I say this all the time. You all have allowed me to execute my passion.
Yeah, I admire you for that. And I just wanted to ask you something else about the YAG visuas. And
yes,
could you explain that to
Absolutely.
me, please?
So think of it this way. When we do lens-based surgery, first of all, what is LaZrPlastique, as you very well understood? Cataract surgery is removing the cataract, replacing with the lens, and going home. You are done. However it was done is a whole different discussion. LaZrPlastique, the way I pioneered this concept over 3 decades is, for example, you're not only fixing the lens part, you're canceling the abnormality of hierarchic cornea optically without touching it. So think about this, like we discussed and you understood before surgery. I entered your eye, but I did not disturb the cut, bulging, irregular cornea of yours, which still has the arcade cuts and everything in it. And through the lens-based surgery, optically we cancel the abnormalities that this causes to the brain visually. So the legs are still fractured, but the hip is moving straight. So that's LaZrPlastique, where without anatomically disturbing, touching, or addressing the abnormal cornea or viewfinder that you have for all your life because it's archaic, I have optically corrected her from inside and at the same time removed her natural lens early cataract so she won't need cataract surgery again. And that too, hopefully without stitches, with the way I want her to experience it. So LaZrPlastique is literally custom designing surgery and visual endpoint, despite having an inaccurate cornea, which still has the scars and cuts in it, which is still changing, and you're done. That's LaZrPlastique. Now, any lens-based surgery, whether it's LaZrPlastique, cataract surgery, lens exchange, refractive lens exchange, we remove the natural lens from your eye. The natural lens is contained in its bag called the capsule. We have to open the front capsule to remove that cataract. We leave behind the back capsule as a hammock to hold the new high-definition lens in the eye forever. That capsule, because it was part of the original cataract, gets hazy over time. So that is something that's progressing in a normal lens or cataract-based surgery. Every patient at some point needs that bag to be opened with a very painless procedure that takes literally a minute or two. You're sitting like this with the laser, we go pop, 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 and you're done. That's needed for every patient, whether you had RK or LASIK or whatever, doesn't matter. That procedure, if you're lens-based surgery, whether it's LaZrPlastique, cataract, RLE, will be needed in every patient. I like to wait at least 3 months to do that and clear the optical zone permanently. It's just needed once.
Okay, great.
In addition to that, your archaic changes are still continuing. So that's what you have to understand, which you already know, but for people watching. So your lens-based surgery part progression is normal for the bags to get hazy and need the laser part, the YAG laser we call it, we use the Visian, and the progression of future age-based things like macular degeneration, dry eyes. Beyond that, the arcade changes are also continuing and the cuts are still there. So there's still distortion in the cornea. That's permanent. But the way we have fixed it is you're seeing through it. So those changes will still cause some fluctuations sometimes. If you go to high altitude, low altitude, you'll see changes in vision like RK always did. And additionally, I'm very aggressive about the tear film. So I also do my m.o.i.s.t technique, which I'm doing for you.
That's what I was going to ask you, that you said,
The
women,
m.o.i.s.t therapy.
and mostly for women.
Yes, because female patients go drier already hormonally over time. And RK made it an even more disturbed ocular surface with the shape. And you're going dry. Now remember, when your windshield goes dry, what happens to the vision? It gets blurry. And the windshield is the same. It could still have cracks in it. But when the wiper goes across and the new fluid comes across, how you suddenly see clearly, that's a welcome side effect of improving your tears that are already deficient.
Wow.
So to me, every aspect that can make your vision better while you still have your distorted cornea, why not go in that direction and get every drop your brain can give me?
Well, that's great. And,
That's
and
right.
how frequent do I have to do the moisturizing?
One time procedure that I do, it takes about 25 minutes, both eyes. And then you just follow the hygiene protocol that we have for the m.o.i.s.t therapy. That's it, you're done.
For the rest of my life?
Again, in medicine, we never say something permanent, but yes, up till now, 21 years follow-up, I've not had to repeat it for anybody.
Wow.
So I do want you all to follow the rhythm, the hygiene of what you have to do to maintain your tears. That's it.
Wow. Well,
So see what happens, I mean, we've discussed, like all my patients in pre-op, I spend hours with you all. How many times did I measure you?
oh, tons, yes. With all kinds of machines.
Yes, very important. And despite that, I love to mention this, given an opportunity. I'll be teaching actually next week at the American Academy Conference in California. And I share this with surgeons all the time, my 3 decades of experience of fixing RK problem. Yes, they are complex. Yes, the accuracy is low. Yes, it's a very difficult surgery. It's very difficult even planning what lens, what optics. But it's possible. And all of them are living examples here. So I never say no when you want to, I call this grilling sessions, right? You like to question me
yeah,
for your friends, because whenever you go
Yeah.
back, all my patients from all over the world, they go back and they're sitting with friends. the talk becomes what lens was used, what cataract surgery. They forget that they had RK. It's a whole different level of performance.
Yeah, and who I was talking was my bowling buddy, so.
Surely. And then the other important thing, Arlene, you already know, but many others still are confused, the lens. Many patients think it's a lens that can do the magic, or the doctor's advertising new lens technologies. Think about it this way. The lens is just an ingredient in the vision recipe of such complex cases. That's where it takes me hours on Sundays where I sit alone in my institute meditating with all the information I've gathered about y'all, and then I plan my surgery. So do not fall for advertising hype of this is a new lens, or here are the 3 options, menu card, this. No, there are over 34 lens options in the United States. If you're getting less than that option, that's incorrect, according to me at least. You should not be given an option of burger, hot dog, or taco for lunch. Let the master chef decide what's right for you.
Oh, you don't know how much I appreciate what you've done for me, and how you've moved your schedule also for me, because you know my next trip is to Bali.
You are unbelievable. But
I'm
yes.
gonna be able to see all the beauty there
And go scuba diving and do crazy
just
stuff.
for you.
My
Yeah,
pleasure.
thank you.
But again, been a pleasure. Whatever this helps the RK patients. Again, this is impromptu in the middle of a busy day, but always have time
thank
for
you.
my amazing patients who come here.
And how do we end this?
How you want.
Like this, thumbs up.
Thumbs up. Okay.